Deadly coronavirus cases are growing worldwide, and here in the U.S., panic is starting to set in as health experts try to track down the source of the first apparent case of community transmission of the virus in California. The mystery surrounding that is now causing the CDC to revise its guidelines on who gets tested. Nick Sturdivant is live outside the CDC in Atlanta with those guidelines and what you need to watch out for if you are sick. Nick.
Yeah, Chrissy, this will allow doctors across the country to test more people suspected of carrying the virus. The CDC posted the new guidelines on its website yesterday, stating that healthcare providers should get a detailed travel history for patients being evaluated for symptoms. According to the CDC, those symptoms are fever, cough, shortness of breath, which could appear in as few as 2 days or as long as 14 days after exposure. This is after California says it's monitoring more than 8,000 people for the coronavirus.